Hello, and welcome to radiologyinfo.org. You are likely here because you recently had a pelvic ultrasound or pelvic MRI, and the report included the word O-RADS or an O-RADS score, and you have questions as to what it all means and what to do next. O-RADS stands for Ovarian and Adnexal Reporting and Data System, where the word adnexa means the area around the ovaries. The O-RADS system is used by radiologists and gynecologists to report what is seen within or next to the ovaries. O-RADS provides a standardized language to communicate a level of concern for ovarian cancer using a numeric score from 0 to 5. Generally speaking, the higher the number score, the greater the level of concern. But keep in mind, an O-RADS score is not a definitive diagnosis. Think of it as a way of helping you and your healthcare provider decide the next best steps together to reduce the likelihood of missing anything worrisome while also avoiding unnecessary anxiety or needless follow-up. Now, before we review O-RADS number scores, let me start by saying that scores of 0 to 3 have a similar meaning whether you have had an ultrasound or an MRI exam. A score of 0 is given when there is a technical reason that does not allow the radiologist to accurately evaluate your ovaries. In your report, it may be recommended that you repeat the exam on another day or consider a different type of exam. For example, if you had an ultrasound which was given a score of 0, the recommendation may be repeating the ultrasound or getting an MRI exam of the pelvis. An O-RADS score of 1 means what is seen in and around the ovaries is completely normal. Nothing more needs to be done. Occasionally, words such as follicle or corpus luteum may be used in the report. These are all part of the egg production process and what we call physiologic cysts. These simply indicate your ovaries are doing their job, and there's nothing to worry about. An exam is scored as an O-RADS 2 when what is seen in and around the ovaries is almost certainly benign. Such observations include larger physiologic cysts that will go away, while others are lesions that will persist. In either event, the likelihood of cancer is so extremely low, most do not require any follow-up at all. When monitoring is needed, the recommendations will be in the report, and the follow-up can vary from a couple of months to up to a year. Rarely, an MRI of the pelvis is recommended to confirm the score. If your gynecologist ordered the exam, they will get the report and continue to treat you. An O-RADS score of 3 means the observation is much more likely to be benign than cancer, and the level of concern for cancer is low. If you are given an O-RADS 3 in your report, you should speak with your gynecologist to determine the next steps. If your initial exam was an ultrasound, you may be referred to a specialist in ultrasound of the ovaries for a second opinion. In some cases, you may be recommended for a pelvic MRI. If you and your doctor decide that monitoring you with either ultrasound or MRI is the best option, they will let you know when you should come back for that exam. Now, O-RADS scores of 4 and 5 carry a different level of concern for cancer when given following an ultrasound exam versus following an MRI exam. So it really depends on which exam you had. For example, a score of 4 on ultrasound means what we are seeing is still more likely to be benign than cancer, but we need more information. In most cases, a referral to a gynecologist and a pelvic MRI or ultrasound specialist will be recommended. Based on those results, your doctor may refer you to a gynecologic oncologist who specializes in ovarian tumors. Together, they will gather more information, which may include blood tests to determine the next best steps that are right for you. In contrast, a score of 4 in an MRI exam report carries a slightly higher level of concern for cancer. While the lesion has an equal likelihood of being benign as being a cancer, it is best to see a gynecologic oncologist to get their opinion. For an O-RADS score of 5, the level of concern for cancer is again higher following an MRI than following an ultrasound. But regardless of which exam you had, it is recommended to see a gynecologic oncologist. A gynecologic oncologist is best able to determine what type of blood tests and additional imaging exams are needed in order to create a personalized management plan. In general, when you have had both an ultrasound and an MRI exam, the score in the exam that you had most recently will typically be the one to guide management. It is important to keep in mind that the management recommendations are given in the report only as general guidance. What is best for you will depend on your symptoms, your personal preferences, and your individual risk for ovarian cancer. This is why you should always inform your care team if you have a family history of gynecologic or breast cancer, as this information may influence your care plan. Finally, a diagnosis of ovarian cancer can only be confirmed with surgery, followed by review from a pathologist. In many cases, the final pathology may reveal a benign condition rather than a cancer. In closing, imaging reports that contain O-RADS scores are written primarily with your healthcare provider in mind, and this can make it hard to understand. So please, write down any questions you may have to ask when you speak to them. All of this information and more can be found at radiologyinfo.org. Thank you for taking this time with me and for allowing me to explain O-RADS.